The lady is referred to me by one of our nurses in our network in Australia for a type of hair loss at the front of her scalp, and she has seen a couple of doctors already and they have recommended to her to get PRP. I look at this lady's scalp and I can see that it's angry, it's red, there's inflammation, there's hyperpigmentation at the hairline, and I'm thinking to myself, actually no, this is a scarring alopecia, and the absolute last thing she should do is be putting needles into her scalp. So that begs the question, when should you get treatments like PRP and when should you not? Well, in today's video, I'm going to take you through 3 big reasons you should not get PRP, platelet-rich plasma, for hair loss. And if you would like to get your hands on our medical boards free hair loss ebook or get $300 off this Grow Laser cap, simply watch to the end and follow the prompts. If we haven't already connected, I'm Dr. Jonathan Hopkirk, Sydney-based hair loss doctor and co-founder of Levels of You, an Australian-based hair restoration company that treats hair loss patients across Australia. And I'm also someone that's been through a decade-long journey with androgenic alopecia, and I've had the highs and the lows of a hair loss journey, including side effects from various treatments. So I love to deliver you key insights into how you can have the best chance of success whilst the lowest chance of side effects or poor outcomes. So as I said, in today's video, we're going to jump into 3 big reasons you should not get PRP. If you're not familiar with what PRP is, platelet-rich plasma, and its use in hair loss, well, platelet-rich plasma is where they draw up your blood, they take a sample of your blood, spin it in a centrifuge, and they then siphon off the platelets. Platelets harness growth factors, which can improve hair density and hair thickness when injected into areas of thinning. It has got some evidence behind it for treating androgenic alopecia, alopecia areata, but there are key reasons why you should not use it. If you want to catch some more videos on PRP, I've done a number of these recently, but to get a better insight into what PRP is, you can check this video out here. All right, key reason number 1 why you should not have platelet-rich plasma injections into your scalp if you're suffering with hair loss. Suspicious lesions. If you have suspicious lesions on your scalp, either diagnosed or undiagnosed, if you've been investigated by a dermatologist because you potentially have a skin cancer or an unknown lesion on your scalp, and the management is still being determined and you're still being investigated for this, or you have a melanoma on your scalp, oh, you should not have something like platelet-rich plasma. If you cause inflammation to the scalp, you can potentially muddy the waters, you could potentially mask what might be going on underneath the surface. So it's so important that if you have suspicious lesions on your scalp, you make sure that these are followed up properly with a dermatologist or your GP as a starting point, and get insights from them as to what they think you should do based on a hair loss treatment program. If they feel you should avoid things like PRP or microneedling in the meantime, or even topicals, because they might say to you, actually, whilst we're still dealing with this unknown lesion or diagnosed lesion, it's best that you should avoid other things. So check in with your health professional. But if you have suspicious lesions, or if you have lesions that are undiagnosed, by all means do not go jabbing needles into your scalp with PRP. Number 2 is if you have active inflammatory disease or active inflammation on the scalp. So things like really inflamed seborrhoeic dermatitis, things such as psoriasis, eczema, lichen planopilaris. If you have these sorts of things where you've got inflammation in the scalp, well, causing further inflammation from injecting the scalp is potentially only going to worsen your situation. And if you have an infection in the scalp, well, then you could potentially spread the infection throughout the remainder of the scalp or in other areas of the scalp. So if you have active inflammation, severe active inflammation, by all means, I would avoid using platelet-rich plasma injections into the scalp for hair loss. And number 3, as was the case in this patient situation who was sent over to me, she had frontal fibrosing alopecia. If you have scarring alopecia, you have a situation in which your body is attacking the follicles. You have inflammation of those follicles. So the last thing you want to do is cause further inflammation, which could worsen your predicament and lead to more aggressive hair loss. So this is a situation where you need to see a hair loss doctor, a specialist, someone that can actually help you. In a sense, you might need systemic therapy. So by all means, do not go getting platelet-rich plasma injections into your scalp if you have a scarring alopecia. Check in with someone who is qualified to be able to give you good guidance on what you should do in this situation. But by all means, pause on causing any inflammation to your scalp if you have potentially or diagnosed scarring alopecia. And for a couple of bonus points, another reason you shouldn't get PRP is if you have moderate to severe or moderate to advanced hair loss, angiogenic alopecia especially, you're not going to get much of a benefit from PRP. So the cost to benefit to risk ratio is going to be low yield. You're not necessarily going to get a great deal out of PRP. It's better for people that have mild to moderate hair loss, and even then, there's no one standardized protocol, so it's hard to give people guarantees over what particular results they may achieve. But definitely, if you have moderate to severe hair loss, I would avoid PRP altogether. It's going to be low yield. And another thing is, if you're unwell yourself, if you have a coagulation issue or blood clotting disorders, or you're systemically unwell and you've had some infections systemically or in your blood, well, the likelihood of getting good platelets extracted from your blood is going to be low, so therefore you would avoid something like platelet-rich plasma, which is where the treatment utilizes the quality of your blood. So if your blood is not high quality, or if there's a reason that you couldn't get the platelets siphoned off from your blood, then you're likely not going to have the best chance of success with this treatment. So there is 3 key reasons you would not get PRP for hair loss, plus a couple little extra bonus pointers. I hope you enjoyed today's video. If you'd like to get your hands on our medical boards, free hair loss ebook, or get $300 off this Grow laser cap that I've used myself over the last 16 months and highly recommend, simply email me at jonathan@levelsofview.com and I will get that over to you ASAP. Tune in for next week's video where I will be talking about PRP head-to-head with PRF, platelet-rich fibrin. Hope you have a good week. Look forward to seeing you next week. Cheers.